Hello, everyone, and welcome back to another presentation of the Midwifery Wisdom Conference here in India. I'm so excited to have you all here. I have one little announcement, and that is that our next session is unfortunately delayed due to our presenter's sickness. And so we will be sharing her recording of her presentation as soon as we get it from her. She got the deli belly and is recovering as the best she can. So we'll get that recording to you guys after the fact. But right now we have a wonderful presentation from my colleague, Dr. Sneha. So I'm going to let Chetna introduce. Thanks, everyone.
Sneha is a serial entrepreneur who has been working with women in their reproductive journey for over 16 years. She started off her career as a physiotherapist and then later on went on to found Matritva and the birth home, which is Karnataka and Bangalore's very first midwifery-led water birth center, natural birth center as well. And now she has started Fem First last year, and all of these businesses of hers have been focused on providing exceptional care and wellness solutions for women. She has extensive knowledge, which is offering culturally matched care, takes into account the physiological and also the psychosocial aspects of reproductive health. And she's an invaluable resource for women seeking healthcare solutions. She's attended over 200 births in different hospital settings and is definitely a force to be reckoned in the industry. I'll hand it over to Sneha. We're really looking forward to your presentation. And today she's going to be talking about pelvic floor muscle strengthening or relaxation. What should we do when we are pregnant? All right, Sneha, take it.
Thank you so much, Chetna and Augustine, for having me here. This has been a wonderful start of the day, of the week, I would say. Till yesterday, I was busy, and then I came, and I was really excited, though my plan was to take a day off. But then the moment I realized that it was the conference, I think my day is just going by amazing. And I think the day started with Barbara Harper, which I am a huge fan of. And learning more about water birth, I think it was just amazing. And now just Katrina presented how beautifully the physiological birth and bodily sovereignty is amazing. So one incident that I still remember was having attended so many births in the hospital. One of the first few births that happened at the birth home, this baby came out. I mean, it was that women was just moving around. It was dark. We were whispering, all the things that, Katrina just discussed. It happened so that the baby came out and the baby was pink and big. But the baby didn't cry loudly, the baby wasn't crying. And I was so scared, like, what just happened? Why is the baby not crying? And I still remember Augustine coming to me, close to me, and holding my hands and saying, hey, honey, it's fine. Babies who are born in a gentler way, they don't cry out loud. We can see the baby pink, we can see the baby breathing, we have heard the baby's heart tone, everything is fine. Just chill and relax and see how it unfolds. And after attending these births, more at the birth home, these babies were very different. They were much more gentler, how they were so independent. The breastfeeding was an amazing journey. I really wish I could have something similar when I was pregnant. I mean, I would not have had that traumatic experience. But I also believe if I wouldn't have that experience, I wouldn't be sitting in front of you. Maybe I was working in a hospital. I've started my own physio clinic working for the ortho or a neuro case. So thank you for, showing the light that I always wanted to. It was just amazing. So on this note, let me share my screen. The slides would be a little technical since I'm a physical therapy. I love everything about it. So there will be a lot of exercises, a lot of techniques that we will be discussing. I hope you will enjoy your session. So here we go. So we will be talking about pelvic floor muscle strengthening or relaxation, because ever since, when I started as a prenatal instructor back in 2011, I was always told to ask women to do Kegels. And me as a person always did Kegels because I always believed that my pelvic floor muscle should be strong to have better sexual life, better sphincter control, all these things. While very recently I realized that it's not that at all. And so this presentation, it's all about either should be doing a strengthening or relaxation. How do we even test either the muscles are tight or loose, and what kind of test can be done, and what are the different exercises that can be used. So Chetna introduced me already. So I would want to start with pelvic floor anatomy. So what are pelvic floor muscles? So it is a dome-shaped muscular sheet that separates the pelvic cavity and the perineal region below. So that's very important to understand what is a pelvic floor muscle, and what it encloses, what it holds are the three organs. Since we are talking about women, I will be talking about that: bladder, intestines, and uterus. So let's talk about functions of pelvic floor muscle that supports the major organs of abdominal cavity. It also helps us to have in control for the stools as well as for urine. That is a part that plays huge role in sexual activity, sexual functioning. It also stabilizes because pelvic floor muscles are attached to the hip joint. It stabilizes the pelvic bone as well as the hip joint, so that we can have an alignment where when we see that the person is walking straight, when the proper alignment, we also see their pelvic floor muscles are functioning absolutely fine. While if we see there has been some dysfunctions in terms of either increased lordotic curve or kyphotic curve, there has been a pelvic floor dysfunction, which is most of the time present. And it also helps in circulation of the blood, which helps to keep the functioning well and keep going. Now let's talk about what are hypertonic muscles, what are hypotonic muscles. So hypotonic muscles are when these muscles' strength or muscle tone is reduced, when the muscles are weak and they lack support. While the hypertonic muscles have an elevated muscle tone, they have tightness and there will be a potential constriction. So what are the signs of hypertonic muscle? The signs are that a woman will have urinary or fecal stress incontinence. That would mean whenever she's sneezing, she's coughing, she's doing any intense activity, she might leak or pass gas or even poop sometimes in case of incontinence. So these are the signs that we see. And we also see the pelvic organ prolapse. This is I've majorly seen in case of menopause or someone who had a traumatic vaginal birth with episiotomy. And sometimes, sadly, the doctor is not even able to recognize it till it impacts the daily activities of her living and vaginal laxity. So what are the reasons? So reasons are pregnancy and childbirth, which is most often spoken about, because during pregnancy, there is a constant pressure on the pelvic floor muscle. So they're doing a lot of work. They're working as a hammock, keeping everything safe inside, everything inside. So aging is one of the reasons, because we see that because of the degenerative changes, there has been a change in the muscles where the muscles could become weaker. Obesity, especially pot-bellied women that we see, because it works similarly like in pregnancy where there's a constant pressure on the pelvic floor muscle. This could lead to weakness of these muscles, and chronic straining while pooping could be one of the reason, and someone who have a sedentary lifestyle. And of course, as we discussed about the menopausal changes that may lead to weakness of the muscles. Now, what are the signs of hypertonic muscle? Overactive pelvic floor is not an isolated dysfunction, but a physical manifestation of patient's emotional state. So I always believe and say that pelvic floor muscles is an emotional muscle. It stores all the emotions. And so we will be discussing about how the emotions impact the pelvic floor muscle. So what are the signs we see that the woman has difficulty in peeing, and she also has urge incontinence where she feels that she's not able to empty her bladder very often. This is very common during pregnancy because of the increased pressure from the uterus, but is also much more prevalent even in non-pregnant cases. We see, and a women would complain of painful sitting, back pain or hip pain. There will be burning sensations or vaginal pain. Vaginismus is one of the reasons where we see it's most often related to hypertonic muscles. And levator ani syndrome that we'll be discussing in the next slide. So while peeing, if you as a person would have realized you have to strain to start the first flow of urine, or the flow isn't strong, it's weak or is spilled, or you have a sensation of not able to complete the bladder very often. You have to go every time just in case, or you have a constant bladder pain or pressure, which can also create sometimes tenderness. So levator and dry syndrome is nothing but is categorized by chronic anal pain that happens especially when a woman is about to pass motions or has just passed motions. It is caused by the tightness in the pelvic floor muscles particularly, and I have seen many cases, especially immediately postpartum. Though we say that, the postpartum, the women would have weaker muscles, but on the contrary, I have found many a times because of episiotomy or third and fourth degree tear, sometimes it can lead to even hypertonic muscle. That's why not one exercise fits all. And so now the signs of hypertonic muscle while pooping. So she may complain of having chronic constipation. She may strain during bowel movement that can lead to hemorrhoids or even anal fissures, rectal pain as in defined by the levator ani syndrome. And this also can lead to incomplete sensation of emptying, that she is going to the washroom, but she's not able to empty completely, or she may feel that she has to go to the washroom more often without even able to empty that. And her stools could be pencil thin or could be extra hard. So what are the reasons for pelvic floor muscle tightness? One of the reasons is prolonged and repeated holding of urine and feces for longer period. This has been extremely common, and the way that, we don't want to use the washrooms in public area whenever we are stepping or we're trying to hold our urine for longer, we are not going to washroom. And even if we are going it, we most likely hover on the toilet seat, which can actually lead to many dysfunctions. Tensed muscles during workout. More so recently, I have been seeing many women who have been pretty active in their life. They have been marathoners, runners, joggers, doing extreme physical activities or going to gym regularly. They have a tendency to contract their muscles because the belief is that when they contract their muscles, they're able to contract their core muscles. And when they do it, it tends to become hypertonic. They tend to become have an elevated muscle tone. Sexual trauma, of course, because this anyone who have had any abuse previously, they tend to contract their muscles more often, and that can also lead to hypertonic muscles. High levels of stress and anxiety, which is present sadly to most of us. So on this note, I just want everybody to just do a simple basic exercise thing, that you try to touch your jaw joint and just press it. A simple thing. Just press it and release. And then press it once more and release. If you have tenderness or pain, in spite of having any trauma or a dental treatment very recently, if you have tenderness or pain, it could be related to your hypertonic muscle. It is very much related to your pelvic floor muscles. So if you feel that you have tenderness, if you have pain, it could be a sign that your muscles are tight and you need not work on the Kegels, but reverse Kegels. And as I said, that birth trauma also sometimes can lead to hypertonic muscle. Not all the postpartum moms will have hypotonic muscles or weak muscles. So what are the tests that we do to understand about the muscle's strength or tonicity? So internal assessment is one of the ways that can be done. I don't prefer doing internal assessment during pregnancy if the woman is not comfortable, but that can be done either pre-pregnancy or in the postpartum time. We can also see the sacrotuberous ligament tightness. And there are two tests which are often do is called as obturator test or the piriformis test. So which we'll be discussing in the upcoming slides. So this is the basic assessment. I call it perfect, which is actually perfect. So first we check on the power. So it's a modified Oxford scale where it is done in the internal assessment, where basically we do an internal assessment and check for the contractions of the pelvic floor muscle. It ranges from 0 to 5. 0 means no contraction, 1 means flicker of contraction, and 5 means very, very strong contractions. And that's we start scoring it. Endurance is how long can they hold a maximum voluntary contraction, and that they can hold it until 10 seconds as well. And how many repetitions can they do in a particular period of time? And fast is how many twitching movement can they do with the pelvic floor muscle? Like this is twitching. This is just contracting and releasing. So how many twitching can they do with the muscles? And every contraction here is timed. There are definitely challenges because pelvic floor muscles are not visible. These are not like biceps that we can see how the muscles, how are they holding weight and see the muscle length. These are very small muscles and it's not visible and women may not feel comfortable. So there are a lot of challenges involved. Many times there's a co-contraction. In spite of you telling them how to do a muscle contraction, she may do a pelvic tilt. She may hold an abdominal muscles, her glutes, her rectal muscle. That basically gives us the false reports, a false result. And at times the patient is not even comfortable. First is to tell them, educate them what are pelvic floor muscles. Tell them how do you contract and how do you relax. And then you start assessing these muscles. One of the tests here is obturator test. So obturator is a muscle. The function is to do an external rotation of the hip, abduction of the hip, which means the hip is going away from the midline, and the hip extension, where the hip is going towards the other side, and which also stabilizes the hip. Now it shares the same partial attachment as with the pelvic floor muscles. So for the test, what we do is we basically, as a therapist, will stand just right next to the person and they will flex the hip at 90 degrees as well as the knee at 90 degrees and try to do an internal rotation and external rotation of the hip. If a woman complains the pain in the internal rotation, that is a sign which is positive and that is potentially related to the hypertonic muscles. And a basic exercise that can be done, because we don't want to strengthen the tight muscles. We want to first lengthen them. So what is it that we can do is the mermaid yoga posture. If you see this woman, how is she exercising? This is a basic exercise that she can do 30 seconds, do it for 3 times, maybe once or twice a day. That will be really helpful in her entire pregnancy or will have rather reduced pelvic pain and will have easier pushing as well. The next test is piriformis, where the function of the piriformis is very similar to obturator internus. There is external rotation, but here is hip abduction with the extension of the hip. This is also a hip stabilizer. So for the test, what we do is we basically bend or flex the hip and knee and then take that affected knee towards the other side of the unaffected or the extended knee, and then we push it. And if a woman complains of pain near the ischial tuberosity or the piriformis region, that could be one of the signs that she has tightness in the piriformis muscle and is also can or will have hypertonic pelvic floor muscles. And a basic exercise that can be done easily, you just need a chair, is you basically sit on the chair, cross-legged, and try to push forward. When you push forward, there's a stretch exactly on the piriformis, and this also can be done for 30 seconds. Do it for 3 times and maybe twice a day. Piriformis tightness also has a strong link on the sciatic nerve, because we have been talking about sciatic nerve impingement or sciatic nerve pain in the pregnancy, which is pretty common. Just doing a simple stretching for the piriformis can help a lot of women to relieve from that excruciating, annoying pain as well. So now the question is, are tight muscles always good? Because I remember the doctor always told me that you should have tight muscles. These will be good and you will have better sexual life and your partner would enjoy and blah, blah, blah. But are they actually good is a question. It's mind-boggling to understand that chronic tightness can actually lead to weakness. Right? When the muscle is continued to be tight, it can lead to weakness and other dysfunctions. And since we are talking about labor and birth, So I will be talking about how it impacts, especially during the pushing time. A woman will have a prolonged pushing phase. It may also impede the baby's descent. It may take longer. Women may have a higher chance of getting third and fourth degree tear. Just the only caveat in India is that everybody gets an episiotomy. But if you aren't doing an episiotomy, you would know that the women will have a higher chance of having third and fourth degree tear. There will be increased pain and discomfort. Since the baby will be continuously resisted by a stronger pelvic floor muscle, the baby may show some signs of distress, and there will be a higher chance of instrumental birth, and again, the higher chances of episiotomy. So thankfully, or rather sadly, that Kegels were invented by a man who was extremely intrigued of what happens to the pelvic floor muscles. And, his name was Dr. Arnold. What he did was he actually assessed the women in the postpartum phase, and he invented a machine called as Kegel perineometer. So it was a machine with, you just insert a probe inside the women's vagina, and then it just worked like a biofeedback. And then you check the strength of the muscle. And he found that mostly in the postpartum moms, they will have weak muscle. And this is when he started Kegels. But today, thankfully, what happened was everybody took Kegels, doing it entire lifetime, starting with preconception, pregnancy, birth, postpartum, menopause. All the time a woman is just told to do Kegels, also in not an appropriate way. Since these are very small muscles, we need to understand first what are these muscles and how do we even contract, or on the contrary, relax. So Kegels is not just contraction, but it is a lift too. It is, you are not just twitching your muscle, rather you're contracting and also lifting it, just like having smoothie from your vagina, or, taking blueberry from your vagina, lifting it up and then slowly releasing it. Different strengthening exercises, what Dr. Arnold said was anterior pelvic floor muscles. How do you strengthen them? Was imagining, or sometimes when a woman is not able to understand, asking them to go to the washroom and trying to stop the mid flow of the urine and then start again. Though I don't recommend a woman to do while urinating all the time, because it can lead to bladder dysfunctions and even UTI, because there will be a retained urine. But what she does basically is to try and tighten or contract the anterior pelvic floor muscle, which is just like stopping the urine. While if we are strengthening the posterior pelvic floor muscle, it's just like stopping of passing of gas. Like how do you contract your rectum? And most of the time what happens is that a woman, when she's told to do these exercises, she would contract her anterior as well as posterior muscles most of the time. So we need to first tell them how to even differentiate and how not to co-contract, how to understand which muscle is actually functioning and how she can contract it, and also similarly relax these muscles. So other strengthening exercises for the pelvic floor muscle is bridging. That is done very often. In inner thigh ball squeeze, if you see a woman, she has kept a ball in between her thighs and she's trying to squeeze that ball and hold it for a few seconds and gently release it. So now in this also, what happens usually is a woman tightens, hold, but just relax. She just immediately releases her muscles. But the way should be done is she contracts, hold, and gently release. What I advise to my moms is that they hold the contraction. Let's say if they're doing it for 3 seconds, and then they also relax in 3 seconds. So they contract, hold, lift, and then start releasing slowly at the count of maybe 3, 2, and 1. Because doing contraction as well as relaxation is very beneficial for all the women out there. And lunges is one of the other exercises that can help a pelvic floor muscle to strengthen. So I have been saying that from the last couple of slides as well. There should be no co-contraction. It's not just squeezing, twitching, and releasing, but it's about contracting and lifting. So you contract as well as you lift these muscles and you perform them while exhalation. So on this note, I really want all of you, I know that your cameras are switched off as well, but wherever you are sitting, so you can sit straight and inhale, inhale, and exhale slowly. Let's do it once more. Inhale and exhale. Now, I want all of you to do this exercise once more, and this time focus on your pelvic floor muscles. Focus on your pelvic floor muscle, what actually is happening with inhalation and exhalation. Can we please do that? Again, inhale. And exhale. Can I ask a question here? When you inhaled, what did you feel your pelvic floor muscles were doing? And when you exhaled, how did your pelvic floor muscles reacted? Can we please get answers? Pelvic floor relax on inhalation. Okay, lovely. I think we are still to get answers from inhaled, contracted, exhaled, relaxed. Yes, Vinuta, okay. So I think these will, because now we have got two different answers. Pelvic floor muscles contracted while inhalation, relaxed during inhalation. Okay, so there are a lot of answers. I'm really thankful that everybody is watching and also doing along with me. So what happens is actually when you inhale, you're relaxing your pelvic floor muscles. You're inhaling, your respiratory diaphragm contracts and your pelvic floor diaphragm relaxes. Okay. So again, let me repeat that. So whenever you are inhaling, there's an increased lung space, there's an increased pressure, your belly moves outwards and your pelvic floor diaphragm actually goes down, which means it's relaxing. On the contrary, when you exhale, your diaphragm muscles relaxes, but your pelvic floor muscles contracts. And believe me, whenever I'm doing this simple exercise with everyone, I always get most of the answers are that during inhalation, they felt their muscles were contracting. And while exhalation, their muscles were relaxing. While it is the opposite, right? So it is extremely important. These are very, very important muscles of our body. And we need to understand. So what I want all of you who said that during inhalation, your muscles contracted is to do a deep breathing exercises along with me. So we do a simple exercise. Just keep your one hand on your chest and one hand on your belly. Sit straight. Okay, and then when you inhale, try to fill air in your belly also. Okay, because we generally we see that women or anyone for that matter, when they breathe, they're mostly chest breathers. They do this. If you see, most of the movements are happening from my upper body part, from my lungs. But the actual movement should happen is whenever a person inhales, there should be increased in the abdominal girth. That means abdominal muscles come out. And then when you exhale, they go in. So let's do this simple exercise. Sit straight and then inhale and try to fill the air in your belly. Inhale. And gently exhale. Inhale, Try to fill your belly with lots and lots of air. You see my hands are expanding, they're spreading out, fingers are spreading out, and then when I exhale, my fingers are becoming closer and my muscles are contracting. So now, when you do this exercise, specifically for someone who said the opposite, you would feel that whenever there's an increase in abdominal girth, when your abdominal muscles come out, you will feel that your pelvic floor muscles are lengthened. Okay, and then when you exhale, when you pull your belly towards you, which happens by itself, you don't need to contract. So these muscles are contracted. So I want each one of you to please practice this. It will take only a minute or two, and you will realize the difference. How were you breathing earlier and the impact that it will have on your pelvic floor muscles. So in case if you were having stress incontinence or urgent incontinence or any kind of pain, this will actually rectify that. So which of your client needs Kegels? Or the reverse Kegel is always a question. Now I'm sure you would know what kind of test needs to be done and what are the signs and symptoms that you would see in the women who would have weaker muscles or maybe an hypertonic muscles. And many times it basically is the combination, as I was saying previously, that contracting the muscle, whenever you're contracting, please ensure that you're also relaxing, releasing your muscles in a much, much gentler way as well. Okay, so now what are these pelvic floor muscle exercises, relaxation exercises? One exercise that I've always talked about is going down elevator exercise. So whenever we are contracting the muscles here, what happens is most of the time of a women, especially if you know that they have hypertonic muscle, since their muscles would be contracting. And when they start doing any kind of contraction, they will start only doing at the mid level. When the muscles are partially contracted. So whenever you're doing any exercise, please ensure that they have done relaxation. And this is when you start doing the Kegels or strengthening as well. So one of the exercise for now, the relaxation is going down elevator. So you would just tell to your clients, or you can do it for yourself as well. Just imagine there's an elevator. Okay, that elevator is your pelvic floor muscle, and you are taking it up, maybe at the third floor. And this is where you start this. And then you ask them to gently release and go down to the second floor, first floor, and the ground floor. So what will happen? It's very easy to contract the muscle. It's very easy when someone tells you to contract. Most likely it would be easier for you, especially, coming, all women here I know are very young. Menopausal women will have a different aspect since we are not taking that. So you will see that a woman who is able to contract in a great way, they may not be able to relax. So please, please tell them repeatedly to release using their belly breathing, which we just did, and also doing it coming down elevator exercise, where they're basically, when they have contracted their muscles and held it up, they're releasing their muscles on the count of 3, coming down gently, and then again coming down, releasing, 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 which may take even 5 seconds for them to release. That's a very crucial exercise. One of the things that I love doing is perineal massage. I always recommend my clients to do perineal massage because most of us, or maybe few of us, would have not even explored our muscles, explored the area down there. So it's one way, it's a good exploration. And it also helps the women in pregnancy to understand how would be the tension, how would be the sensation when the baby is coming down there. Because it's a very different feeling if the women have not felt that. She may be trying to get away from it, trying to avoid it as much as possible. So just telling them to do a perineal massage, they can do it by themselves or their partner can do it. They can just use their fingers or maybe the wands which are available, they can do that as well. And doing that, I don't know if they actually prevent or reduce the tears, but what I know is they definitely empower women to understand and know about these sensations and help them to have a better birthing experience. And yes, breathing, where the woman is breathing, inhaling, and then while exhaling, she's making a sound of so just doing an S breathing is really helpful. If you see one of the poses here where the pink shirt women is doing is just a baby exercise. How would the baby hold their toes and just move from one side to the other? That is one more exercise that actually helps to relax the pelvic floor muscle. And biofeedback is something, because as I said, many women doesn't even know if their muscles are tight or loose or how they're contracting. Are they contracting only the pelvic floor muscles, or are they using their abdominal muscles? One of the ways is a biofeedback machine. Though in pregnancy, I don't recommend using a machine and inserting something inside, but as simple as that, they can use a mirror, look at the pelvic floor muscles and see while they're contracting what's happening to these muscles, and while they're releasing what's actually happening. There's one more technique that I love doing is myofascial techniques that we will be sharing in the next slide. And the legs supported on the wall. The last exercise that I really awe is with a constructive iliopsoas posture. If you see the first figure, where the women is just lying down with an elevated, posture with the support of lot of pillows and cushions, and the hips are gently flexed, and staying that in for around 20 to 30 minutes in a day would really help the muscles to relax and the pelvic floor muscles to be birth ready, I would say. There are few stretching exercises as well, which helps to relax the pelvic floor muscle. These are simple cow-cat stretches that we know most of us are aware and have been teaching our clients as well. Downward dog posture and knee to chest position that also helps to relax, because whenever you're standing, knowingly or unknowingly, you are trying to contract these muscles when you come to a gravity resisted postures. When these muscles have no tension from the gravity, you would feel that your muscles are much more relaxed. And when the erector muscles or the hip muscles are relaxed, the pelvic floor muscles will tend to release and lengthen as well. Quadriceps stretching. If you see this woman in a blue t-shirt stretching her quads, that also is one exercise that actually helps to release our tight muscles and the butterfly stretches. The myofascial technique, which I was talking about, is either when you know that a particular muscle that we talked about, like obturator internus, adductors, stantia fascia lata, these are very typical physiotherapy muscles. I don't want to go in detail, but if you find there's a tightness specifically for the piriformis that we discussed, you can use your elbow, your wrist. You can also use your thumb. But what I prefer, since these muscles are pretty deep, is to use either a trigger ball or a tennis ball and just keep it beneath her tight muscles and ask her to gently just roll very slowly. She would feel that the entire muscles which are tight and tender, they are releasing, and the trigger points or the tightness would reduce, and you would also see the immediate difference in her gait, in the pattern that she is walking. And also sometimes it can actually alleviate the pubic pain, the pelvic pain as well. So as I was saying that in hovering, please ensure that you are sitting and preferably using a squatty potty that actually releases your pelvic floor, hypertonic pelvic floor muscles. And please stop power peeing. I have seen most of my friends saying that whenever they go, they just start the flow and just a very strong form, and they feel so relieved. But they also complain is that they have constant urge. They feel their bladder hasn't emptied and they are going to the washroom much more often without having the actual need. So just doing this simple change of using a squatty potty while you are peeing or pooping can actually help, with your muscles. So this is the wand that I was talking about that can be used in the perineal massage during pregnancy as well. I recommend women doing the massage after 34 weeks only, and making sure she doesn't have any kind of infection. And it is a good idea that we can tell them what to expect, what will happen when they start doing exercises, start doing these massages, what is it to expect, and initially starting a shorter span of time and slowly increasing the duration. This sacrotuberous ligament, this is very, I have seen, especially in runners, it's very, very tight. So gently kneading at the sacrotuberous ligament is really important to release. In this photo, if you can see that it's basically done on the skeleton when it is lying on the prone position, because that is the easiest position. But during pregnancy, we know it's not possible, and getting massage chairs for the pregnant women is even more difficult. So I prefer doing it in all four position. I just ask them to come in all four position and start releasing it by either using my fingers or even sometimes using a ball. Okay, so this is something which is not absolutely related to pelvic floor muscle, but this is what, since we have a little time, I would like to cover that as well. That during pregnancy, what we see as a change happens is there's a anterior pelvic tilt and an increased lordotic curve, right? Which is very common, and more so in with the Indian women when they are trying to cover their belly with a dupatta, because of evil eye and all, they tend to increase, they're basically doing an exaggerated anterior pelvic tilt, and this leads to increased lordotic curve. And then they would have penguin walk when they're walking just like that. They aren't using their hip muscles or the knee muscles for that matter, and continues to complain of pain. So here we see that this women, since of increased lordotic curve, would have lengthened abdominal muscles and the lengthened glutei, because the way that she's standing, it will be like this. So these muscles are lengthened, so are these glutei muscles. And the muscles which are tight are the hip flexors and the back muscle, because she's always trying to come and stand in this posture. So just doing stretching of the muscles which are contracted or shortened, and doing strengthening for the muscles which are weak is really helpful. And that I have seen that impacts the pelvic floor muscles. If we see there is a tightness, this is the first thing that I evaluate, and I ask women to come on this protocol, start using these stretching and strengthening exercises, and that has had great impact on their entire pregnancy journey, where they didn't have any kind of pains and aches, and also had a easier pushing. And when I'm saying pushing, these women didn't have an episiotomy or an instrumental birth, most of them. And basically the work started in their pregnancy itself, where we evaluated and worked on these different hyper or hypertonic muscles, and then the stretching and strengthening. And this actually led to great results. So, yeah. So I'm here at the end of my slide. I love these pictures. I'm sure Chetan and Augustine would remember these amazing births that we had at our birth home. Okay, so yeah, here I am. Thank you so much for patiently listening to me for 45 minutes and doing what I suggested to all of you. So yeah, if you have any questions, please put that on the chat box, or you can unmute yourself and ask a question.
Thank you so much, Sneha. That was very, very informative, as usual. I think, the pelvic floor plays such an important role, throughout our entire lives, and specifically when, everything is moved around in our abdomen during pregnancy. And, making our clients feel comfortable in pregnancy and functional, both in pregnancy, childbirth, and definitely the postpartum period should be, one of the focus areas for all care providers, I would say. Yeah, thank you.
Absolutely. I think the understanding of what muscles are we seeing and making a tailor-made approach. It should not be one size doesn't fit all. So we'll have to first evaluate. And I just want to say, if you are an instructor or helping a women do exercise or telling them what exercises, please ensure that you know now what pelvic floor muscles need to be taught and how are they doing it.
Mhm. So Aisha has a question. Can you shed some light on inter-abdominal pressure during belly breathing? How to balance it?
Yep. Since we talked about anterior pelvic tilt, the muscles, there's an increased abdominal pressure, of course, one, and there's an increased lordotic curve. So working on the posture, that is one. And sometimes, especially in the primary, you would see that there's a hypertonic or maybe a good tone abdominal muscle. So that wouldn't impact any kind of belly breathing. But I have seen women with diastasis, major diastasis recti, and then whenever they're doing a belly breathing, they're actually doing a reverse breathing. So first thing is to tell them, first to sensitize of how are they filling air in their belly and then slowly releasing it. So one thing that I see, I saw one of the videos of an influencer was that every pregnant women were doing Kapalbhati. With the increased abdominal pressure, they are even increasing that pressure that leads to major problems, major dysfunctions, not just to a mom, but to the baby as well. So making sure how their muscles are and then, asking them to do these exercises, these belly breathing doesn't have an impact on the intra-abdominal pressure. So feel free to do it for all your moms for sure.
Yeah, I think, my takeaway is that balance is really the key over here. And, mindfully moving so that we have some balance can help us all. Anisa is asking if it is possible to do releasing practice during birth, between or during contractions.
So if you are asking a woman while she is in active labor or even pushing to release her muscles is very difficult because she hasn't done it entire pregnancy or even before that. So prenatal explanation and telling them how to release muscles are much easier. One thing that I do during the labor, if I find that, we were not able to meet often during the prenatal time, is to gently doing these releases on the jaw muscles has helped many women, but the impact isn't that much that would have happened when we would have done that in the prenatal care as well.
All right. So moving on, next question. Urvashi is asking if how do you evaluate belly dancing during pregnancy as a preparation for birthing?
Ah, that's very interesting. I mean, frankly, I've not seen any women who has been doing belly dancing per se. So maybe I can read and come back to you. But doing these gentle movements of pelvic tilt whenever you're moving your pelvis, because belly dancing is a dance where you're using a lot of pelvic, you're using a lot of pelvis and pelvic movement. There's a tilt, there's a rotation, counter nutation, all these things that actually helps women to release all that tightness, to release the stress, anxiety, and maybe, on also does help during the labor and birth as well.
All right. If anyone else has questions, please go ahead and turn on your screens and ask or drop them in the chat. But I'd also like to really thank you, Sneha, for presenting at our conference. Yeah, everyone has their information. Yeah, I think someone has a question. Go ahead, Shraddha.
Shraddha has a question. Hi, Shraddha.
Hi, Dr. Sneha. I have a question wherein, so you mentioned for people when they either pee or when they go to potty, use the stool, potty stool. So is it for both peeing and
yes,
so
absolutely.
it helps in both, is it? I thought
Both.
only long standing is what is needed. Even for peeing, they would need it, is it?
Yes.
That helps.
Because if, I did a simple research on my friends only, especially who complained of power peeing and they were not able to empty their bladder, just making use of that squatty potty or the potty stool, you could say, that actually helped them to pee and empty their bladder, and slowly their urge incontinence or where they felt every time they needed to pee reduced considerably. It took some time, but yes, it was very helpful.
So how I understand is maybe it will help reduce hypotonicity and also hypertonicity. Both. Does it balance using
So,
that?
so hypertonicity is the weakness where we need to work on the muscles to strengthen. So
Hmm.
that is mostly stress incontinence, like when you're coughing, when you're lifting anything heavy, or even laughing, some women may leak. That is called as stress incontinence. That happens because of the weak muscle. Now, on the contrary, when a woman complains of an urge incontinence where she's not able to empty her bladder completely, or she feels that urge to go very often and doesn't pee, or there's a very minimal amount, this is a very peculiar sign of hypertonic muscle. But having said that, using this tool would actually help both the hypertonic as well as hypertonic muscles as well.
Okay. Yeah. Thank you.
Thank you.
All right. So we have on the screen information about how you can get in touch with Sneha in case you have more questions or you want to refer clients to her for physiotherapy. Thank you so much, Sneha. It was lovely. And we'll see you in the next few sessions as well.